The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh, and today we're going to be talking about women's health issues. And so if you're a lady or have friends that are ladies, this is the time to tune in. And today joining us to talk about women's health issues is Dr. Eric Shadle. And we're happy that you're with us today, and we're glad that you can join us to talk about women's health issues. Now, I understand you've been in practice for about 15, 16 years.
That's correct, yes.
And obstetrics and gynecology.
Yes.
And so you see all kinds of women's health issues. What do people or what do women perceive as their largest health concern, especially when they reach the age of menopause?
Well, the number one cause for concern that women have is cancer. Actually, a study was done where they questioned menopausal women, and 40% were concerned about breast cancer, and another 15% were concerned about other types of cancer as the number one cause of death in women. At least that was their perception.
So breast cancer being the big concern?
Their biggest concern. Actually, they asked them, what do you think you will die from? And 40% said breast cancer. But actually, that's not the most important problem of women's health, though breast cancer is a very significant one. Of cancers, of women's cancers, breast cancer is only the second leading cause of death, second to lung cancer.
So smokers and lung cancer.
That's right, that's right.
Okay, so then what is the leading cause of problems in women, the leading cause of death for people or ladies after menopause?
Well, the leading cause of death is cardiovascular disease. It's actually responsible for more deaths than all other causes combined.
So it's the number one killer, just like it is with men.
It's the number one killer, just like it is with men. That's right. It's the biggest public health problem that we face in this country is cardiovascular disease. The incidence of heart attacks rise with age with both men and women, and 40% who have a heart attack, the first symptom is sudden death. So it's certainly a scary issue and problem, but it's still, I find it very interesting that women are still more afraid of breast cancer than they are of cardiovascular disease.
They seem to just be able to live with that because everybody has that problem. But
I think that's right. I think they just see that cardiovascular disease is something that we just live with in this society, but cancer is, the word itself brings certain emotions to bear, I think.
Back to this issue of cardiovascular disease, however, you know, some people or ladies that I hear talking say that they've gone on estrogen replacement therapy so that they will decrease their risk of cardiovascular disease, or because I guess their physician says that's changing now. And is that something we should talk about?
Absolutely. That's you've brought up a very good question. We should look at estrogen replacement therapy and the traditional risk factors that are talked about in the medical community. And let's just list those risk factors. These are the traditional risk factors that physicians use today to give estrogen replacement therapy. And the first is a personal history, that, you know, a history of heart disease. An increasing age. As we get older, we have more risk. Estrogen deficiency. dyslipidemia, which simply means lipid disorders, high cholesterol, we could say. There's additional risk factors such as diabetes, smoking, high blood pressure, peripheral vascular disease. That would be like atherosclerosis.
Hardening of the arteries.
Hardening of the arteries, that's
Okay.
right. Now, what I find interesting about this list, this is the list that is published in all of our journals. It would be a list that's in our textbooks. I find it very interesting that there's no lifestyle issues there other than smoking. Smoking is the only one that's a lifestyle issue that they talk about as a risk factor.
And when you mean lifestyle, when you say lifestyle issue, you mean something they could do something about.
That's right. That's
All right.
right. That the patient themselves, that the person would take primary responsibility for their own health. And I think the reason for that is that physicians today, we are not trained to involve the patient themselves in their own health, and yet we all have in our own power the power to control our health.
To choose what's good to eat.
To choose, to make the right choices.
In terms of lifestyle. So let's then talk more about that. What kind of lifestyle things should we be doing? Or another way to put it is, how does this relate to estrogens? Can we eat foods that are high in estrogens?
Well, I do want to get to that maybe a little later in the program, but first of all, what we eat has the most important thing to do with heart disease, and that is our cholesterol. We know that high cholesterol is one of the basic foundation points for heart disease, for cardiovascular disease, for hardening of the arteries. And if you don't have a high cholesterol level, you're not going to get hardening of the arteries, and then you're not going to have a heart attack.
So you don't have to replace supposedly your estrogen. You're really addressing a more fundamental issue.
That's right.
Is that what you're talking about?
That's right. It's a much more fundamental issue.
Which I think you talk about this, or we've talked about this, is primary versus secondary prevention.
Yes.
And what do you mean exactly by that?
Well, primary prevention of heart disease is someone who has never had any known disease. They've never had a heart attack, they've never had any symptoms, and so you want to help that person prevent heart disease from occurring, whereas secondary prevention of heart disease is a person who's already had a heart attack, but now you're trying to help them prevent another heart attack.
Okay. Of course, the second group would probably be more highly motivated.
Yeah, absolutely.
Since they already had a heart attack.
Absolutely.
And the other ones, they probably are just looking at you like you're from the planet somewhere.
They've had their heart attack. They've had their wake-up call, and knowing that 40% will actually die during their first heart attack. So they're part of that 60%, obviously, and now we're very interested in secondary prevention.
Let's go back for a minute to primary prevention, though. What role does estrogen replacement therapy have in primary prevention? In other words, they haven't had a heart attack yet and they want to avoid it.
Well, let me answer that by saying that the pharmaceutical companies, the drug companies in this country, market estrogen very heavily as a way to prevent heart disease. And they make those claims based on retrospective studies, that is, studies that look back at patients' history, and they don't have good control groups, and so they've looked at these retrospective studies that have indicated as much as a 50% reduced risk of heart attack, primary prevention, in women who take estrogen replacement therapy. And so they use that data and say, wow, all women need to be on estrogen in order to prevent heart disease. And it gets a lot of press. It gets in the Ladies' Home Journal and Time Magazine and all these things. Good Housekeeping and all those. And then we have women coming in and saying, well, I think I need to take estrogen because there's heart disease in my family. But interestingly enough, there's a couple of very good studies that are ongoing right now, and one of them is the Women's Health Initiative, WHI study, that has actually changed the recommendations for estrogen in association with primary prevention. And as a result of that study, the American Heart Association does not recommend HRT, which is hormone replacement therapy, or ERT, that's estrogen replacement therapy, just estrogen by itself, for the prevention of coronary heart disease or heart attacks.
So that's completely different than what they're saying.
That's exactly right.
So they're not recommending, they don't think it really has any primary role in preventing.
That's absolutely. The American Heart Association does not, and that's because this was a large prospective placebo-controlled study designed to impact on women's use of both unopposed estrogen, that is estrogen where you take it by itself, as well as hormone replacement therapy, which would be estrogen plus progesterone.
Okay, so in other words, when you say double blind and all controlled and placebo and all that, that means they've looked at everything and now they're really getting real data instead of just looking back.
That's right.
And anecdotally maybe saying, well, we think we see this as a marketing tool. The drug companies were using that, but now this real study is saying, no, there's not really a role in preventing cardiovascular disease.
Not only is there not a role, but they actually found that there's a small increase in the number of cardiovascular events in those women taking hormone replacement therapy. Now, it's not enough to stop the study. The study is still ongoing. It's not due to be completed until the year 2005. But you have to be concerned about those kind of findings.
Okay, so in other words, instead of finding that it prevents it, it could even potentiate it, but it's not, or make it worse, but it's not to the level where they have to stop a study because it's really a dangerous thing.
That's right.
Okay. Wow, so that's completely different. So again, everything you see on TV, and of course we're on TV right now, it kind of shoots us in the foot, but everything you see on TV or everything you hear on the radio or everything you read in whatever magazine or journal, it doesn't necessarily match with the facts if you're trying to avoid the number one killer of women, which is heart disease.
That's right. There is the Nurses' Health Study, which is another prospective study with over 70,000 postmenopausal women. That study did show a small decrease in the risk of coronary events. However, it wasn't enough that the American Heart Association is convinced, and that study is ongoing as well, and we're going to see what that has to say about some of these risks. It looks like that the women that actually have a decreased risk in coronary events in the Nurses' Health Study are those who are also seeking medical care and have better lifestyle as well. And so there may be some confounding factors that are making it difficult to tell whether estrogen is having that much of an effect on cardiovascular disease or not.
So the one study says absolutely no effect. This next study says, well, there may be some kind of increase or decrease, but it's probably related to some other kind of factor. That's what they're saying.
Yes, that's right.
Okay. So the bottom line then, at least, and there is no bottom line yet, is what you're saying.
Yes.
You can't give a bottom line yet, but it appears to be that this is not really estrogen replacement therapy in preventing heart disease is not really the right tree to be barking up.
Yeah, and really you think about it, it doesn't make that much sense to be looking at that anyway, because there are so many other lifestyle factors that we probably should be talking about at some point. But estrogen, I'm not sure, is really one of those lifestyle factors that we need to be looking at, certainly for cardiovascular disease.
So nobody watching the program needs to go out and buy those pills and start taking them to prevent it.
Not to prevent heart disease, that's right.
Now what about secondary? We were talking about primary prevention. Yeah. What about secondary prevention? Well, should we be taking some hormones then? Or?
You know, you would think that secondary prevention, if estrogen is going to decrease the risk for heart disease, it would decrease it for secondary prevention more certainly than primary, because if you look at these lifestyle live-in programs that affect our how we eat, and they teach us
exercise,
cooking, all that
and
stuff, decreased fat intake and that kind of thing. What you want to find are the sickest people, The people that have the heart attacks, the people that have the most weight, the people that have the worst cholesterol and diabetes and all that, and you see dramatic change. So you would expect to see the same thing with estrogen. You want to find the sickest people to see the biggest change if there's something that's going to affect it. And so with estrogen, we certainly expected to see that with in secondary prevention studies. And there's something called the HERS study, that's capitals HERS, with a little over 2,700 women, postmenopausal women under the age of 80 who already had coronary heart disease. And what we found with this study was that they actually had an increased risk for coronary events if they were taking hormone replacement therapy during that first year. So the women who were taking hormone replacement therapy in the HERS study, they'd already had a heart attack. You put them on hormone replacement, that's estrogen and progesterone, and you find that there's an increase in the number of heart attacks in that first year.
Wow. So in other words, maybe what does that mean? It could mean, if playing off what we said about primary prevention, it could mean that these are the type of people that think, hey, I'm just going to take a pill instead of changing my lifestyle. Is that what you...
That's right.
Is that the conclusion you're drawing?
Yes. We'd much rather take a pill than have to change our lifestyle, because sometimes that seems too difficult to do. And
so physicians shy away from talking about those kind of things, and certainly people, if they can just take a pill and still be having whatever they want to eat, they're going to do that.
I think so. Physicians don't talk about it much because, first of all, most physicians need to change their lifestyle, to be honest with you. And so it's kind of hard to tell your patient to change a lifestyle factor when you're not living that way yourself.
That's right.
So it becomes very difficult.
So then what role does diet play in the prevention of cardiovascular disease? What have you seen?
Well, to me, diet is really the lifestyle factor that we need to be talking about with cardiovascular disease. And it affects so many parts of our lives, and obviously it affects so many different diseases that we might have. We really need a cholesterol of under 160, maybe even under 150, to reduce plaque that is already in our arteries and to prevent cardiovascular disease. And yet, in this country, what we find is that we actually have levels of 190 or 200 that is considered normal in this country. But we have multiple studies that definitely demonstrate a link between diet and cardiovascular disease.
So you really didn't focus in on that. You know, you can take drugs now, like your statins and all these different things, statin medications, that they make your cholesterol just go down.
That's right.
It's another pill. I mean, it's not estrogen, but it's another pill. And are there any hazards to just saying, hey, I took care of the problem that way?
Well, taking these statin medications, which do lower our cholesterol, does appear to decrease one's cardiovascular risk. You would expect it to if you can get your cholesterol down. The concern that I have, first of all, it doesn't make much sense to be taking a medication to lower cholesterol when we're eating a lot of cholesterol and we're eating a lot of saturated fats and animal proteins that is going to raise our cholesterol. It seems to me much wiser to lower our cholesterol by simply making a few simple changes in our diet.
We're talking with Dr. Eric Shadle. We've been talking about women's health issues. We've been talking about cardiovascular disease, talking about estrogen replacement therapy, and the doctor has just said, look, we need to take a closer look at lifestyle issues. And when we come back, we're going to look at some practical things about what you can do to decrease your risk of the #1 killer of women, #2 killer of women. All those are related together, so join us when we come back.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Deal and Dr. Eileen Luddington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who were able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Deal and Dr. Luddington have been featured on 3ABN, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Eric Shadle, and we've been talking about women's health issues. We've been talking about heart disease. We've been talking about how estrogen replacement therapy relates to that. And you kind of shocked me, but what you suggested, and you've had the studies and whatnot, is that although the bottom line is not yet known, it appears that it's not as helpful as we've been led to believe over the last couple of years.
That's right.
And so we need to look at more than just taking a pill. Because there maybe are some problems with pills. Are there problems with pills? I mean, one of the things you do a lot as a physician is help people access what's behind that nice little counter at the pharmacy.
That's right.
Are there any problems with that?
And part of it is that patients have an expectation for that. So they come in, they're not expecting me to tell them, well, maybe you should eat more fruits and vegetables. They're wanting me to take out my prescription pad and write
help
them.
You get behind that counter.
And then all their problems will be solved. But the problem with medications is that every single medication has side effects. And the statins, the medications that you were talking about earlier that lower our cholesterol, certainly have problems with our liver and perhaps the kidneys, and they really should be taken as the very last resort. I've got to tell you that I had many of the same views, say about 5 years ago, as most of my medical colleagues do in town, and that is that you give a woman, every menopausal woman, estrogen, and you'll help her with heart disease and all this, until Dr. Deal came to Rockford, Illinois, and put on the CHIP program, the Coronary Health Improvement Project, and I can just give a personal testimony that it absolutely changed my life. And as I have looked at research, looked at these studies, I just am absolutely convinced that what we need to be doing is changing our lifestyle, particularly in the area of our diet. And we need to be eating less fat, less animal protein. We need to eat the grains and the vegetables and the fruits, nuts, those types of things, and we're going to get everything that we need, and it's going to impact so many different levels. Here today we're talking about cardiovascular disease, and it definitely impacts that, but it also impacts so many other areas of our health as well.
So instead of just taking the pill, I mean, what we've talked about so far is women, number one, think that the thing that's going to get them is breast cancer.
That's right.
But if you take these plant foods and whatnot, that's been shown to have protective things even against cancer.
Even against breast cancer, absolutely.
And then secondly, we talked about cardiovascular disease as it relates to estrogen replacement therapy, and you're saying, hey, the things are not behind the counter, they're down the aisle, and they're all different colors.
That's right. That's right.
So Dr. Hans Deal, tell me a little bit more about this, the Coronary Health
Improvement Project.
Or they sometimes call it CHIP.
CHIP,
And
yes.
This has been really now effective in helping patients in your practice.
That's right. Actually, our church, we are currently doing our third CHIP program, and I'm involved in it because I like to refer my patients to the CHIP program. I have patients that have concerns about heart disease. They have menopausal symptoms. They have all of these issues. They're overweight. They might have high blood pressure. And instead of just giving them a pill, I can sit down and talk to them about there might be some changes that they could do to simplify their lives. And I can send them to the CHIP program, which is a program that we do over the course of 30 days that changes people's lives in ways that I've never seen before in my medical career.
So it's addressing, you mentioned these things. You mentioned hypertension, high blood pressure. You mentioned overweight. You mentioned diabetes. You mentioned all those different things, which I guess the reason you're mentioning those is because this program we've been saying, hey, estrogens are supposed to protect us from this. They don't really protect us from heart disease and these other things. But if you really want to get a handle on what to do about that, these are the things to do, and the CHIP program sort of covers that.
That's right. That's right. In our particular program, we find 20% decrease in cholesterol levels in just 4 weeks. So here we are having people come into the program, and in 4 weeks, by making a few simple lifestyle changes, including cutting out the meats and the high fats, the dairy, and some of that we so readily consume, their cholesterol goes down, their weight comes down, they find the pounds coming off, and they all have so much more energy, and it's just a tremendous program.
That's really quite a testimony, and really it puts the individual in the driver's seat when you address these major components of heart disease, like the CHIP program or other programs mentioned here on 3ABN. They can really be involved.
That's right.
That should reduce their stress, which is one thing I want to ask you about. What's the role of stress in cardiovascular disease, and how can we reduce it?
Well, that's an interesting question, because a study at Duke University, which involved patients who had heart disease, found that negative emotions such as tension, sadness, frustration, actually could triple the risk of significant decreases in blood supply to the heart muscle, and thus cause more heart attacks. Whereas positive emotions could actually improve blood supply to the heart muscle. And so I think the spiritual life, here's another example of where one's spiritual life, getting in connection with God, can actually have a positive physiologic effect on our beings, and actually make us healthier.
I think what you've shared with us today in terms of women's health has hopefully reduced the stress of a lot of people watching, because really what you're saying is we so often want to take pills and potions and lotions and this and that, but really God has provided all kinds of things for us to help us. They're not behind a counter in some sort of most holy place,
That's right.
but they're out there in the supermarket where you can be involved, and as you come to know Him and His plan for your life, both in diet and in stress reduction and all these different things, you can live longer and healthier as a result. Thank you so much for being with us. And thank you for being with us at home. We hope you join us on the next episode of Health for a Lifetime.